Let's say we go on a block, let's say there's 15, 20 houses. I would say potentially at least 10 possibly have lead-based paint on them, about half. Especially in Wyandotte County, a lot of the homes east of 635 have this issue of having homes with lead-based paint on them. The symptoms of having lead poison, fatigue, headaches, shortness of breath, there are symptoms of everything, just regular flu-like symptoms, whatnot. But in children, specifically, we notice that it lowers their IQ. It causes learning disabilities. It can also cause behavioral issues. That's where we try to jump in. That 0 to 6 years old is a huge time, or a huge point in children's lives and their development. So that's why we try to catch it so early. So for children, it's ingesting, and then for adults, it's inhaling. So kids usually eat lead-based paint because it has a sweet taste to it. People don't know that. So they're like, oh, this is kind of good. So we see kids eating lead chips and biting on window sills, or going to certain areas in the home where there's a lot of lead dust, crawling around. Kids are crawling around their toys. Then they're putting those things in their mouths, and they're constantly being exposed. I went to my supervisor and I was like, hey, this is a program that our community needs. Like, we really need this program. We decided to apply for the program, and we received $3.9 million. And we're really excited to continue to bring this program to our residents. It's a free program. That's what I try to tell families all the time. It's free. Whether or not you're renting or you own, tell your landlord it's free, or tell your husband or your wife that it's free. We come out to your home, we help fix the issue, and we take care of your children and your family. We want to make sure that we capture everyone. We want to make sure that we don't leave anyone out, and we want to make sure that there aren't any barriers for landlords to apply for our program. Made it a priority to make sure landlords don't have to pay anything for this grant. They want to make sure that, like I said, there's no barriers. We want them to apply. We want their families to get the services that they need, and make sure that we get their home taken care of. Get your home worked on for free. You just got to apply for it. We'll even work on a multifamily unit. So like I said, duplex or apartment complex.
For the risk assessment, our risk assessor is going to test the interior and exterior of the home to see if there's lead-based paint. And if it is determined, that's where we come in and help. This is one of the prime examples of lead-based paint. So you can see the chipping and flaking paint throughout on the window component, and also on the wood window on the inside. So you can see those are prime examples of lead-based paint. So if it's lead, we'll come over and make sure that we get encapsulation paint over it. But if it's a window, we can replace the whole window component. We can replace everything in their window. So people will have brand new windows, energy efficient windows. This could be very expensive for the homeowner, but our program is free.
Give us a call at the health department, ask questions about our program, and if you would like to apply, we can either email or mail you an application. That way you can look over it and see if this is something that you're interested in, and if you qualify. There are certain qualifications that you must have for this program. There's an income guideline. There's a ton of documents that HUD requires. It's a federal program. But as long as you can apply or provide us with all that information, it's free, like I said. Testing for kids, we typically refer them to their primary care physician, but if they don't have a primary care physician, we test at the health department. We either do a finger stick, which is a capillary test, or we do a venous test, blood draw from the arm. Healthy Homes is additional funding that was given to us by HUD. Which we're super excited about. So this allows us to look for other hazards in the home besides lead.
So what they're going to do, one is going to test for radon. They're going to put a device in the basement to be able to determine if radon, and if they need a mitigation system in the home. We have our Healthy Homes professional. They're going to check all the smoke alarms, carbon monoxide detectors. They're going to look for any hazards within the home that would be hazardous for the family and for the children. So we're going to look at handrails. We're going to make sure that there are transition strips throughout the home. We're going to look at all of those different things. So for example, on the outlet here, you see there's nothing over it. We want to get receptacle plug covers to make sure we cover this up the way kids don't stick forks in there, or toys, or anything else that they could put in there to possibly electrocute themselves. We will cover that up with receptacle plug covers throughout the home. That way the child is safe. We want to make sure that cabinets are not accessible to children, so we want to make sure that we get basically kind of like zip ties or any cabinet locks that the child can't get into. So we apply those to the cabinets. That way the children are safe and they don't get any dangerous chemicals from under the sinks or anything else that they're not supposed to get into. So near a water source, we want to make sure that we have a GFCI outlet over here. We want to make sure we get combo units of the smoke alarms and carbon monoxide detectors. I think these are just smoke alarms. So we want to make sure that we include that carbon monoxide piece because that's so important. Our program and the goal of public health is to be there for the community and provide those resources to them. That way they can, be happy and be healthy, and we can make sure that they're taken care of.
How much does it cost?
Free. The program is free.